Right. Well, it's top of the hour, and I know we got a lot going on. So I want to just say thanks for joining us. And Christy, do you want to kick us off?
Yes, good afternoon, everyone. Thank you so much for joining WorkSource and the Apple STEM Network for today's Meet the Employer. We are so thankful to have Family Health Center's amazing team with us today to share some great information about Family Health Center's career and apprenticeship opportunities. Before we dive in, I wanted to share how this Zoom event will work. To keep noise levels to a minimum, all microphones will be muted during the presentation. At the end of the presentation, we will have some dedicated time for questions. You will have an opportunity to share your questions through the chat feature by clicking the chat button on the bottom of your screen or by raising your hand. We will call on folks who raise their hand and enable their audio so that they can ask their question. Now, it is my pleasure to turn it over to Carrie Falori, Human Resources and Risk Management Director, and Jesus Hernandez, Chief Executive Officer from Family Health Centers, to introduce themselves and kick off our presentation. Good afternoon, Carrie and Jesus. Thank you so much for joining us today.
Thank you, Christy, and everyone thank you to Orville School District and the North Central ESD for making this happen. Warm holiday greetings to all the students and staff. It's a time of the year when we can be so grateful for all the blessings we have. And thank everyone for everything you have been doing to stay safe and keep others safe from this pandemic that we're all living through. So thank you for that. Super excited to be introducing to you Family Health Centers today in this virtual Meet the Employer. We have some team members with us from Family Health Centers that are going to be introduced a little bit later, and Carrie will share a little bit more specifics about some of the career opportunities that we have at Family Health Centers. We also have two of our superstars, community health workers who recently joined Family Health Centers to share with you their initial experience of joining our team. So we'll have that coming up. With that, my part is to sort of do an overview of who we are at Family Health Center, so you can get a sense of what we do, what we aspire to be as an organization, so you can have a better sense of what kind of career paths you might want to be seeking at Family Health Centers. So with that, let me just share that Family Health Centers is a system of clinics. We serve all of Okanagan County and North Douglas County. We have 6 medical clinics, 5 dental clinics, 2 pharmacies that do a lot of mail pharmacy as well. We also have a dental program that with clinics across the county, and we're very proud of the presence that we have across this large rural county. In addition to these clinical services, we also operate what's called a WIC program, Women, Infant, and Children, that provides a lot of services to young families, young parents. This program works closely with our providers who do OB deliveries at our local at Mid-Valley Hospital, which is our hospital that does deliveries for the county. And you know, there's a couple other areas that I also like to celebrate, and that is we are doing a lot of work beyond the traditional scope of healthcare. When we help our patients with their medical and healthcare needs, we're also trying to address all their needs in terms of social needs. For example, sometimes health can be impacted by lack of housing, lack of food, lack of transportation. So we work with partners, other organizations who help address those needs for our patients so that they can access those services, those primary care or primary needs that are so important. You know, there's also, in addition to the COVID pandemic, we have been fighting an epidemic that started before COVID, and that is the epidemic across this country of addictions, of different types of addictions, whether it's opioids or other addictions. So we're doing a lot of work in that area, and we're very proud of that. We are a health system that prides itself in ensuring people have access to healthcare, regardless of their ability and their circumstances and their ability to pay. So we take care of the richest person and the least richest person. So we're very much, our mission is to ensure access to healthcare and to provide really comprehensive health services. So now you got a sense of the scope of the region we serve and the kinds of services we provide. Let me tell you a little bit about who we are in terms of our mission, our values, and our organizational culture, which is very important when you think about who you are going to be joining when you come and engage in a career path with family health centers. And I'm sure when you hear from our community health workers a little bit later, they'll probably speak to how they felt as they joined family health centers. But we're very proud of this mission. Our mission is to improve the health of the entire community. Just that phrase alone is a very ambitious mission that we embrace. And we know that we need to be humble enough to understand that we can't do it alone. We can only achieve that mission by partnering with other organizations like school districts, like other health systems, transportation, and others that I mentioned earlier. And so we do that through collaboration, patient care, and education. And we try to deliver positive patient experiences, and of course to ensure that it's affordable. That is our mission, and we're very proud of that mission. I want to say also that when you join family health centers, you're actually joining also a network of 27 community health centers like family health centers across the state of Washington. So the career paths that you might consider at family health centers could easily be transferable to other parts of the state if you were to want to stay within this segment of healthcare. So when you join family health centers, you can expect that an organization that is every day striving to live up to these values that are outlined in this page: high integrity, honesty in how we deal with each other and with our patients, accountable, being responsible for our actions and our work, an organization that has the courage to make difficult decisions many times. A lot of our patients, a lot of our staff have demonstrated tremendous courage and bravery, especially during this pandemic when they had to put their own health and actually even their family's health at risk in order to be out there taking care of patients who might be carrying the COVID virus. And so there's tremendous courage in doing that work. And of course, you can't be in healthcare if you don't have a strong level of sympathy for others, compassion for people, especially people who are less fortunate than we are. And so those are very important values that when you join family health centers, we ask everyone to live up to and to hold ourselves to. There are some very specific, what we call core dimensions in how we interact with each other here at family health centers. These are essentially sort of ground rules for how we treat ourselves and how we communicate with each other. Obviously, a high degree of respect for everyone. We are proud of the diversity, the inclusion in our organization. We have people of all walks of life, and we welcome everyone. Of course, empathy, being genuine, being authentic in what we say and do. That's an important core dimension for us. And specificity is very important, especially in healthcare, that we take responsibility that for others to really understand what we say, the message we are trying to get across. So we approach that with a lot of attention and achieving a degree of excellence in communicating effectively with everyone. If we go to the next slide, I'm going to get a little deeper into what this means for you in terms of potential future members of our family health centers team. If you look across the top of the slide, there are these important important aspirations that we strive to achieve in the way we run this company. We want to ensure that people have meaningful work. When we hire people, we try to make sure that they get all the support for them to be successful in the specific role that they've chosen. If sometimes we find that somebody's not really cut out for the role that they initially applied for, and we always look to see if there's another role within family health centers that maybe it's a better fit. We want the work here to be challenging intellectually and to build resilience in people. It's very much our goal to be really a human development organization, an organization that uplifts people by helping increase their confidence in themselves by achieving success day after day. In terms of leadership, we strive to be a leadership at every level of the organization that is trustworthy, that lives up to our mission, our vision, our values, that we do everything with competence and character. And then also that our supervisors all the way up to my level we're hands-on. We don't just spend our time in an office. We are out there engaging with all employees on a regular basis, really cheering people up and helping wherever we can. And we're always making sure that we're looking for the best ideas from everyone in continuously improving the work environment and the services we provide. So it's a culture of excellence that we're all working towards every day. We have processes in place to measure our progress, measure our work, measure our quality of work so that we can focus in continuous improvement efforts. We want to create an opportunity here at Family Health Centers where people can grow professionally and personally. So as I mentioned, not only is there opportunities for people to come to work at Family Health Centers in a specific job, and then maybe look into other aspects of our work, but even move on to other community health centers across the state or across the country, because there's community health centers actually across the nation. Finally, health and wellness. We often celebrate the importance of delivering what we call whole person health. In other words, like I said earlier, not just taking care of the physical needs and the behavioral health needs, but really the social needs of everyone. But we also expect that of ourselves. So we work to ensure that people that are working at family health centers are taking care of themselves, that we support those efforts so that people can be at their best, so we can give our best every day to our patients and to each other. So as you think about family health centers and who you might be considering joining, if you're looking at us as a potential career path, you can expect that this is what we're all striving to be every day. And the kind of environment that you would be finding here. I often hear people after being employed for, first 3 months, we often get asked for feedback, and it's really wonderful to see people share with us that they love the people they're working with. They appreciate how welcoming that people were towards them, and how helpful that people are being in helping them learn their role, whatever that role is. So that's, I always like to celebrate that, emphasize that. And when people leave family health centers, I always like to, we do an exit interview, and we always want people to know this is who you're leaving. In case you want to come back, that that's who you're coming back to, because we're going to continue to stay on this path to be this kind of company that is truly an employer of choice, and also a provider of healthcare of choice in this area that we serve. So let me pause there and invite one of our 2 community health workers to share a little bit what their experience has been, how long they've been with family health centers, and a little bit about what they've learned and how they're feeling about their new job. Who's going to go first, Elijah or
I can go first.
And Jorge next? Okay.
Yep.
Who's going first?
Elijah, I can.
Okay, great. And then Jorge will go next.
Can everybody hear me okay? Okay, awesome. Yeah, I am a community health centers. I am an employee of community health centers. I am a community health worker, and I am a part of the outreach department in that. I was hired on about mid-September, so I've been here for a couple months now. And I originally, out of high school, kind of like sympathizing with you guys out there, the seniors, wanted to get away from like the small town. And I wanted to get away from like this world because I like grew up in Tonasket. And I left and I went to college, and I had all the adventures and fun stuff there, but I found myself missing like the environment and all of the benefits that come along with this. So out of college, I came over to back into the area, and I got employed by family health centers. And the biggest thing for me as a community health worker, where we are organizing outreach events, whether that be with the homeless, whether that be relating to vaccines, or just giving away food. A big challenge for us is to not only discover what we can do to help, but like problem solve and plan as we're along the way. And I think the coolest thing about family health centers that they did for me was from the very first day, my ideas were heard, listened to by my entire team, by my employer, by my boss. I, at every point, felt like I was immediately a professional, and from the very get-go, just listened to and able to help out wherever I can.
That's great, Elijah. One of the comments that stuck with me earlier when we spoke was that when you left, you didn't think there were a lot of opportunities here in Okanagan, and then you come back and then you realize that there are actually a lot of opportunities like the ones you found here at family health centers.
Yeah, absolutely. And then continuing onwards in family health centers, where I could go in a multitude of different paths from this entry-level community health worker position.
That's great. We were excited to have you on board, Elijah.
Thank you.
Let's go to Jorge.
Hello, my name is Jorge. I've been with Family Health Center, community health worker, for about a month and a half now. And similar to Elijah and adding on as well, I did not expect this job position really to help my community in and out of a clinic to a great extent. And apart from that, see that there's actually a lot of job opportunities. More than I can see if you just look at the front desk or anything like that. Well, most of the time you look at the application, you think you need maybe a medical degree or an interest in healthcare, and really an entry-level job, you pretty much just need one thing to really get started. That's the desire to care or empathize with your community. It's something you will always be tested at the job. And truth be told, it's not as hard as it sounds. The reason being that the staff members you work with have the same interests as you. It's actually contagious that it makes you want to do better every day when you go to work. But at the same time, I would recommend you guys consider this kind of employment. I mean, it doesn't have to be your first, your second, maybe not even your third. But however, I would ask you to leave like a spot in your top because in my opinion, it's one of the many paths towards becoming aware of what you're really trying to do in your life. And truth be told, this job was not my top choice. It was actually my top 3. But considering the description of how it could really help my community, I started backwards. And since then, I have just really loved this job, interacting with my community in such a way that out in the street, they'll recognize me, and I don't know why. So.
Jorge, in our conversations, one of the things that impressed me about you is how much the mission resonated with you. Our mission to help and uplift people. I really appreciated hearing that from you. That mission really resonated with you.
Oh yes, I mean, with that, it's like since I was a kid, family health center has been in my family. So there's been the staff members, services, providers, and I've been on one end. I've always experienced this end. Now I have the opportunity to experience the other end and help those that were in my position. And In a way, I told my interviewers, I think I can do it better. So, I mean, I kind of regret it a little bit, but at the same time, I could see where, I mean, I come with a different perspective in a different area in my community. So I really genuinely believe I can help Family Health Center um, gain more trust in the community.
And I truly believe that you will make it better, Jorge, because you've experienced us as a patient, your family as patients, and now you understand how patients feel, and that's how we keep getting better and better. I want to emphasize before we go to Carrie, that as Jorge mentioned, when you think of a healthcare system like Family Health Centers, you just think of medical career paths, but in reality, there's all kinds of different types of work that you can do. There's non-clinical. For example, we have the business side of the house where you might be doing billing, you might be doing financials, you might be doing some sort of management role. There's a marketing component to our business. There is a human resource component to our business. Most importantly, it's about engaging people. I often like to highlight that even though we're a healthcare business, we're really a people business. And it's about being our best at people, being our best at treating people from every circumstances. So not just in the patient setting, but how we treat each other as individual professionals, how we treat our public. And so it's really a people business. And so we got to get good at people. So let me move on then and ask Carrie to provide some more specifics. We also have Donna Hale, one of our superstars in HR, to help us with Q&A a little bit down further along in our presentation.
Thank you, Jesus. And I just want to say, both Elijah and Jorge, they really embody the spirit of what makes Family Health Centers so special. And that's why we wanted them to come here today and be able to share their journey and their story with you. So you can envision yourself doing things like that as you sit in those chairs and wonder about your future and your careers. Family Health Centers definitely should be top priority for employer of choice in your mind. So thank you so much for that. And I think you can see just by how passionate Jesus is that this is truly in the DNA of our entire organization. And so when he talks about it being a people first organization, that's a perfect intro to me as the director of human resources, because I'm very passionate about people. And we want you to know that there's a lot of different pieces that we can have you join our team. And like Jesus said, it doesn't just have to be the medical side, the dental side. We have the entire business operations side. And as you just saw, we have community health workers and all kinds of outreach as well. So you can go ahead and go on to the next slide, but this one just talks a little bit about all the different positions that we have. One of those, for example, is dental assistant. We have a dental assistant apprenticeship, which takes approximately a year of on-the-job training. And then once you learn the competencies, you finish up the dental assistant apprenticeship and look at joining the team as a dental assistant. So really you can picture yourself in a career that quickly, which is very exciting. And you're making a large difference and impact in the community. Being a dental assistant is such a rewarding career, and it's only one of many that we have available at Family Health Centers. So we need people that can work in specialty dentics, including endodontics, oral surgeons, orthodontics. We're looking at all different pieces. And like Jesus said, we're really looking at how we can serve the whole person. So it's their medical needs, their dental needs, their social needs, all the different things, behavioral health, that come and apply to helping a person find their wellness and well-being and healthiest self. Family Health Centers will do the on-the-job training with you, helping you understand what to expect so you can work side by side with those who are working in a career that you are, learning to become the best at, having that mentor side by side to help show you what to do next. And our goal is really just to train and really interact with each person. We understand that people are not cookie cutter. Everybody's going to have a different level of engagement that they need as far as training. And we just really are excited at the opportunity to let you know we have these apprenticeships available. And there's a little note down at the bottom of the slide that on average, dental assistants in Washington make over $47,000 a year. And I only mention that because I know that some of you sitting there, you're thinking, well, this sounds great, but I do need to know if I can support myself in this career. So just wanted to mention that before we move to the next slide. Some growth opportunities within being a dental assistant as a starting point. You can look at lab technician and you can see kind of the range there, dental hygienist and the range there, dental office manager, etc. And Jesus, did you have anything else to add to the dental before we move on?
Yeah, both in terms of this entry-level clinical roles, we do a lot of on-the-job training in collaboration with institutions that help with the academic side of those apprenticeships. So for folks who are coming right out of high school, for example, this could be a great place to start learning something that becomes a career path with a lot of support. A lot of times, people like medical assistants have told me that the path of being on the job, learning hands-on, being mentored by others, while they're also working with Wenatchee Valley College or a state association with the academic side of that training, that education, really makes a huge difference compared to just not having that on-the-job training aspect of the entry.
Thank you so much. And we can go to the next slide. So when we're talking about medical assistants and apprenticeships, that's probably the first thing that popped into your head when you heard that you were going to come and hear a talk on family health centers. And now you know that's one piece of our business and our contribution to the greater area. As a medical assistant certified, you can play a vital role in helping the patients. I mean, this is really the opening the door to making a giant difference in a person's life. And we have many stories about the significant impact that medical assistants have had on the overall well-being of patients. And so you would do tasks like, for example, going over their medical history, administering medications, performing EKGs. Our apprenticeship for this takes about 18 months. And it's going to be, a journey that each person takes on their own, and with that varying level and degree of support that Jesus was talking about. You can go to the next slide. And here again, what does it boil down for you as far as not just helping your heart, but taking care of you financially? Medical records, you could be looking at $33,000 to $54,000 a year. Medical lab technician, all the way up to $69,000 a year. Registered nurses, you can see the range there for them. Again, really important. And I would say that it's again a spring off point. You can start here and you can just keep going along your journey. Jesus, did you have anything to add on the medical side?
I just wanted to emphasize that we have wonderful stories about people that started as an MA or a dental assistant, and they've gone on to become a licensed practitioner. We have Dr. Medrano, who was with us for a short time, and he went back to get his pediatrics from the Medrano family in Brewster. He started as a dental assistant, then he went on and became a dentist, came back, worked for us for a few years, and now he went to get his pediatric certification on top of what his general dentistry degree. It's just wonderful to see those people come into family health centers and move on along their chosen career path.
Thank you so much. Speaking of career paths, here's just a few of them that we can talk about. Medical scheduler, patient care coordinator, pharmacy assistant, human resources representative, community health worker. These are all positions that are actually open right now. So we'll talk a little bit more how to apply. And so, yeah, as we were saying, there's so many different avenues when you consider family health centers as your potential employer. And when you join family health centers, you're joining a family. And you're also expanding your potential opportunities for your growth and for your future, for your own family. So you can kind of see the little bubbles in here. For example, one of the positions open, human resource representative, that's in my department. So again, that's, you know, not necessarily in a clinic somewhere, but it has an impact that is absolutely important on every clinic. Patient care coordinator, you know, we need these compassionate people right on the front lines helping us to help our patients. Same with medical scheduler. And then you've heard from 2 outstanding community health workers. And so I think you can see that we really truly have a lot of different paths that you can go down. And we haven't talked a lot about pharmacy and pharmacy assistant, but that's part of our network as well. So Jesus, did you have anything to add to any of those career paths?
Yeah, pharmacy is another area where we have excellent entry-level opportunities where you can start as a technician or a pharmacy assistant and move on to become an actual licensed pharmacist. And then the other piece is you could start any one of these areas and decide that you want to move to another area. And so people are always finding that from having been exposed to areas that before they didn't think they would be interested in. But once you get exposed to something, you go, well, oh, that looks like something I might be interested in. And so you're being exposed to something that otherwise it might remain a mystery. So a lot of interaction across the various departments of the business.
And just to piggyback on what Jesus said, it is really important to us to find that fit for each person. So it might be that you do start down one path and it turns out not to be the path you want to stay on. And so you might make a lateral move or jump to a different path. And that's part of what he was talking about with our mission and values. We really do want to support people to find the work that is most meaningful for them, because we know that ultimately that's going to translate into you having the biggest impact on our patients and our community. Here's more. Just when you thought that was it, we have behavioral health, we have OB and women's care, we have naturopathic medicine. I bet not all of you realize we have that. And then we talked a little bit about the dental and just brushed a little bit on the nursing, and then physicians. I mean, we have so many pieces beyond college, beyond the starting points that you can get into as a permanent career or a lifelong career. And I would really encourage you to visit our website and really look into all of the details for each of these areas. I think when Jesus was talking earlier about how we provide support to the whole person, that has a huge aspect of the behavioral health that we take care of. And thank you. That's going to leave this information up for a second so you guys can kind of absorb it without me just reading it all to you. But these are all the many areas at family health centers that are very exciting for you to potentially explore as you're sitting there thinking about your options and thinking about your future.
I think one of the impressions that new employees often appreciate is all of a sudden they have the opportunity to interact personally on a very personal level with a doctor or a dentist or a behavioral health specialist, and just learning how they got to where they're at, the route they took, and just sharing those stories. There's a lot of power in people sharing their stories, and we want you to share your story when you join family health centers, because that's how we connect as human beings, and that's how we create those relationships where we mentor each other, we learn from each other, we uplift each other every day to be our best.
Thank you so much. So what do you do now? You are obviously in the middle of making some big decisions or thinking about making those big decisions. And so you're thinking about, how can I prepare for a potential career and pathway at family health centers? Some things to really think about. Some subjects would be the list down here: anatomy, physiology, biology, computer applications, Spanish, food nutrition, public speaking. Those are some ideas of how you can really enrich yourself to be more successful as you move along a career path in this field. Required education, high school, diploma or GED. And then for some of these positions, you do need to have some college and some higher education. But I would say that, for a lot of our starting off points and a lot of our programs, you can get in the door right now and start an apprenticeship and really kind of build yourself up as you're also working on your education. And then those transferable skills, I mean, it really does come down to empathy and communication. We need people who want to make a difference, who care about making a difference, who genuinely want to be a part of something bigger and have a huge impact on themselves, the community, and those around them. That's kind of the ingredients to success at family health centers. Did you have anything to add here, Jesus?
I love that you highlighted IT because I forgot to mention that earlier. We have a great IT department, IT team. If you're someone that likes that area of work, we run a lot of different over 30 some different software applications. We have to manage our electronic health records. So our IT team is constantly helping others with optimizing the use of those systems, optimizing the use of our communications in-house, whether it's email or our intranet. There's just a lot of opportunity for learning the IT business within this organization. That's just another great example.
Yep. Family Health Centers offers a generous benefits package and it's competitive. So we do have the 401k, we have dental and vision available with life insurance, and we have employer paid health insurance. So we're really excited about our benefits packages, and we're looking at our total rewards and compensation on an annual basis to kind of always make sure we're staying up with the competition and pushing ahead. So that's just a kind of a short summary of benefits, but you have to always keep your eyes open and your ears open because we're always looking to improve them as well. So most importantly, how to apply, please head over to our website. We have the address right here, myfamilyhealth.org/careers. And we do have Donna on the phone who can answer some additional questions, but in a nutshell, what you'll need is a resume and cover letter and your proof of COVID vaccine. And then, we're gonna look at your application. You can mail it in, you can fax it in, you can email it in. We're happy to take it whatever way you can get to us. You can even take it to a clinic near you. We just want to know who you are and what you're interested in so we can try to match you up with opportunities. And that's kind of it in a nutshell as far as applying. So we should open it up to Q&A. I'll give it back to you, Christy.
Thank you so much, Carrie and Jesus, Elijah and Jorge. What an amazing presentation that really spoke to the heart of the work that you do and the opportunities that you have at family health centers, and really emphasizing that it feels like if you start at the beginning, there are opportunities to go anywhere within family health centers. Thank you so very much. And now we would like to open it up for questions. So for anyone in attendance that has any questions that they would like to ask of our guests, please feel free to type any of them into the chat box or unmute yourself and ask away. Tammy, do you have any questions in the chat?
Right now, no, I don't.
I had one question. One thing that we didn't get to speak on was the possibility of anybody being able to do like a job shadow or informational interview with current employees. Are either of those options available for people that are interested in learning a little bit more or seeing a particular job on site, or maybe even being able to speak one-on-one with somebody who does a job that they might be interested in?
Yeah, Christy. In fact, we're having conversations with Oroville School District about that. They're interested in having doing some job shadowing. It's especially easy if the student is already 18 years of age, in terms of getting them exposed to some of the clinical areas. But if you're not of 18 years of age, we can still work with your parents to get you some exposure to other aspects of our business. in healthcare, one very important consideration is the privacy of our patients. So we have to be very careful to protect that privacy. That's why we got to be somewhat careful or very careful in how we bring in people who are not actual employees and get them exposed to the business.
So I see that there's another question in the chat. If a person is doing an apprenticeship, are they expected to take college coursework at the same time?
It depends on the apprenticeship. Usually there is an academic component in addition to the on-the-job training component. For example, in the MA, the medical assistant apprenticeship, we would enroll you with, there's a state association that community health centers like Family Health Centers is part of, and they administer the academic side of the apprenticeship. It's online, so you're working with someone who's guiding you in the academic side of that training and education, while you're also showing up to work and learning on the job.
Is there a minimum of hours for the apprenticeship that you have to complete? And if so, what is that?
Yeah, again, it depends on the apprenticeship, but I'll use the example of the MA and the DA, the medical assistant and dental assistant. The medical assistant, I believe, is about 18 months to go through the entire process to actually achieve a state certification that that is transferable or goes with you wherever you go. With a dental assistant apprenticeship is actually something we do in-house. Once you get employed and start that apprenticeship, you are doing on-the-job training. We have the academic aspect also facilitated in-house, and then we register you with the state so that you become a registered dental assistant.
And I see a question for both Elijah and Jorge. Someone is wondering if, even though you are both very new to your positions, do either or both of you have an idea of somewhere within family health centers that you would like to go next?
I can field this one. Yeah, it's actually a pretty common topic inside of like our team. Something that I have been interested in working on is going into the pharmaceutical side of things and going and being a pharmacy assistant and slowly working my way up that way. But just a real quick, a cool thing going on with that is that one requires you to be bilingual. And for my current position, it is preferred that you be bilingual. And I am actually able through family health centers to, while I'm working, be learning Spanish on the job. And so I can take that with me. And when I am fully bilingual and I have been able to make a ton of progress just in the couple of months that I've been doing it, then I can have that option of moving into those jobs. But yeah, I've been thinking of going into pharmacy. I have another coworker who's been thinking of going into opioid treatment and helping out with that side of things. But yeah, no, it's very encouraged to be talking about it, figuring out where you want to go. And yeah, I think we all have something we have our eyes on.
Thank you, Elijah. Jorge, you have any thoughts on that?
Yeah, I mean, like I said, I'm very, very new to this as well. Considering there's so many positions, like I said, you don't see it up front. And it's all coming in, and it really makes me think. But I mean, same time, I'm not sure, because I've yet to really, in my position, my job position, I can collaborate and work with other type of positions. So I still have that opportunity to at least try and collaborate or work next to a lot of people to get a better idea. So I see myself still staying here. One way or another, I'm still going to be serving my community.
I know that Lisa, your supervisor, will hate to lose you right now. So
Yes.
And for anyone else that is in the audience that has a question, you can feel free to just unmute yourself and ask that question if you're more comfortable doing it that way, or go ahead and just type it in the chat.
While people are thinking about their questions, Christy, I'd like to share perspective for students as they think about what life goals they might set for themselves. A lot of times, early on, because of the exposure that maybe you had to a particular career, because of maybe what your parents do, you know pretty well that you want to go into something that you're pretty familiar with. But a lot of times we are not. I certainly wasn't when I graduated from high school. I had no idea what I might be interested in. So instead of setting a goal about it related to a specific job or career, my goal was simply to achieve a quality of life that I tried to define for myself, a quality of life that included a desire or a situation where I could achieve, where I could travel, I could have a nice home, I could have a nice car, I could have a nice family. That's the picture of the quality of life that I defined for myself. That was my goal. So my goal wasn't a specific career, a specific job. It was the quality of life that I wanted for me in the future. And that was enough. Having that goal well defined was enough for me to really be inspired and be motivated every day to pursue the various steps. Whether first it was going to college, getting up and getting all the homework done, all those things that are tough to do sometimes, because education is not easy, but it sure pays off. But having a goal really allows you to find the grit, find the resilience, and the motivation to get through the tough part. Think about your goals in terms of what's the quality of life you want for yourself 15 years from now, 10 years from now, 30 years from now. Define that for yourselves, and that becomes your passion, achieving that quality of life. And it may take a lot of different jobs, a lot of different career paths to get there, but that really can help.
Thank you so much for sharing that. And I know that we have some students that need to be returning back to class now. So I think that is a perfect place to close this out. And thank you again, everyone, for joining us. I think I do have one more slide after this. Tammy, did you want to just speak to the YouTube channel real quick?
Yeah, so don't forget to subscribe to our YouTube channel. It's where we have all of the recordings for virtual Meet the Employers, as well as other career panels and career connected learning resources. And within 24 hours, we have everything uploaded. So yeah, thanks.
And we just wanted to thank Family Health Centers and your team again so very much for really providing such an inspirational information session for our students and our community members. This has been really amazing, and we can't tell you how much we appreciate you, and also the partnership with our high schools and our community members that were able to attend today. Thank you so much. We look forward to seeing you on future events, and we look forward to seeing all of your applications with Family Health Centers. Thank you, and have a wonderful, wonderful day.
Thank you, and Merry Christmas to everyone.
Merry
Thank you,
Christmas, everyone.
everybody. Thank you. Happy holidays.